A community-based health insurance cooperative says it will continue to move forward with its plans to offer lower-cost health care and insurance premiums for area residents, despite Mercy Medical Center's surprise decision to pull out of the cooperative's negotiations. I'm Wendy Graham-Settle. You're watching the Local News Network. Supporters of a proposed health insurance cooperative gathered at Mercy Medical Center earlier this week to protest Centura Health's decision to withdraw from the Southwest Health Alliance. Centura Health owns 17 hospitals, including Mercy Medical Center, and a network of clinics and healthcare providers in Colorado and western Kansas. In an ad that appeared in the Durango Herald after its withdrawal from negotiations, Centura Health said it will lower Mercy's prices by at least 20% and will work directly with Rocky Mountain Health Plans and Anthem Blue Cross Blue Shield to lower health insurance premiums based on its lower prices.
I think a more accurate description of that would be that last week we chose not to respond to their request for proposal by their deadline last Friday. I don't see it as withdrawing from discussions with Southwest Health Alliance. I see it more simply we just chose not to respond to the request for a proposal. All we've done this week is lower our hospital prices for the two large insurance carriers that are the predominant insurance carriers for La Plata County. No other changes, no new network, no restrictions on access, nothing different other than we've decided to lower our rates for commercially insured patients by 20%. And importantly, and this is a really important point, 2 days ago, we dropped our rates for the people without insurance in this community. There's 10,000 people in the Four Corners region that have no insurance for whatever reason. They choose not to, they don't have access to it, they can't afford it. This week, 2 days ago, we went live with new pricing for that population. So we've been able to have an immediate impact, not for the 5,000, 5,100 people that were part of a group purchasing cooperative for health insurance, but more than that, the 10,000 folks that are without insurance today.
Leaders with the Southwest Health Alliance say they are angry and frustrated with the Denver-based healthcare network and that they feel betrayed by the surprise move.
For the last year, we have been working with all of the different healthcare providers here, including Centura and Mercy, including Southwest Memorial and Cortez, Animas Surgical Hospital, all of the hundreds of local independent healthcare providers. And last week was the big week where we were going to finalize the negotiations that we, the community, were having. And up until that point, for months, Centura said, yep, we'll be getting you that fee schedule. Yep, we're here at the table. We're looking forward to working with you. And literally at the 11th hour, we were told, well, our executives said no.
The Southwest Health Alliance arose from a health needs assessment conducted in 2018 by Local First, a nonprofit organization representing local businesses, and the Durango Network, an organization representing local independent healthcare providers and organizations. Local First members wanted their organization to tackle rising healthcare costs that were impeding employers' ability to hire and keep top employees. Out of that effort, Local First discovered Peak Health Alliance, a successful health insurance cooperative based in Summit County. Peak Alliance worked with local healthcare providers, including Centura's St. Anthony Summit Medical Center, to lower fees for services, and armed with the fee schedule as leverage, worked with local insurance companies to lower health insurance premiums. The Southwest Health Alliance, which includes healthcare providers in La Plata and Montezuma County, had been working with Peak Health Alliance for nearly a year to negotiate lower healthcare fees from local providers when Centura withdrew from the negotiations. In its ad published earlier this month in the Durango Herald, Centura said that third-party solutions like Peak Alliance don't always correspond to reductions in consumer costs, and furthermore, may narrow consumers' choices.
I think the biggest lesson, and I think we've been saying this all along, is that every community solution is probably going to be a little different, and one size does not fit all. And what has worked well in Summit County and where we're headed with that relationship, we never anticipated that working in a place like Pueblo or Canyon City or Durango, because the underlying underpinnings of those communities are very, very different. The local economics are very different. The employer base is very, very different. And so I think that healthcare solutions are going to have to be tailored to those communities. So we never thought that a one-size-fits-all would work. We're proud to be a partner with Peak Health Alliance in Summit County, but we never anticipated that exact model being implemented here.
After the first year in business, Peak Health Alliance lowered health insurance premiums in Summit County by more than 20% and included many healthcare providers that were not in the Centura system. While Southwest Health Alliance leaders acknowledge Centura's efforts to lower healthcare costs, they also expressed concern that Centura's plan is vague, lacks transparency, and will further limit consumer choice.
The question is, what does your alternative plan look like? Is it a narrow network that only steers patients to Mercy and to Centura hospitals? Because if that's the case, a monopoly is not the reality our community wants. And it was precisely the community crafted local healthcare plan that was asking every single provider that wants to be at the table can sit at the table. And we were in the middle of discussions with all of them. So it seems to me that Centura is making a choice that's in their own best interest and that only steers their patients and business and their bottom line to Centura hospitals.
Centura says it will immediately lower prices for uninsured patients, and it has posted its new fee schedule on its website. Patients who have insurance with Anthem or Rocky Mountain Health Plan should see a reduction in their health insurance premiums and out-of-pocket expenses by mid-year. Gessel added that Mercy's new lower prices also will be available to customers who are looking to purchase health insurance through the Southwest Health Alliance, and he anticipates further conversations with the cooperative. In the meantime, Southwest Health Alliance says it will continue to pursue cost reductions with a wide variety of healthcare providers in the area.
If Mercy and Centura don't come to the table, our only option is to start looking elsewhere for some of these services, and it'll be a real loss, while at the same time underscoring the fact that we do still have a vibrant, diverse healthcare ecosystem here, and that's precisely what we're trying to maintain.
If you'd like to know more about the Southwest Health Alliance, visit foundation.localfirst.org. To see Mercy's new schedule of fees, visit centura.org/locations/Mercy Regional Medical Center. Thanks for watching this edition of Local News Network. If you'd like to see this story again, visit our website where you can sign up to have us deliver your news directly to your inbox. I'm Wendy Graham Settle for the Local News Network.